Dr. Joy Stedman, and if you're watching this, then you may want to know something about your labor epidural. Now, labor epidurals have been around for a long time. They've been performed in the United States literally since the 1940s. They didn't really start getting popular, though, until the 1980s and onward. And there's been a lot of research out there that some of it hasn't been particularly well done, describing things that can happen with labor epidurals, such as slowing your labor down and stuff. However, we're going to talk about those things, but let's talk about the actual process of getting a labor epidural. All right? Now, I want to draw you a picture. Here. Now, if you think of this as your spinal cord floats in a sac of fluid, and the sac of fluid goes down a few inches below where the spinal cord ends. And this is where we do spinal and epidural anesthesia. And the little bones that you can feel when you reach back there are called spinous processes. They're kind of like clothes hangers for the muscles of the back, and we don't get to go through them. The needle's not strong enough, so we have to get between them. How you sit is crucial, and what we want you to do is slouch, because that lets these bones open up a little bit and allows us to slide a needle in between. Now, the part of the epidural that hurts is the numbing medicine in the skin. It's kind of like a bad bee sting, if you will. And then we're going to slide the needle in between, and when we go between these spinous processes, we go through a little tiny ligament that's called the interspinous ligament, and we're also going to go through a great big ligament called the ligamentum flavum. And you'll feel a lot of pressure when we go through the ligamentum flavum. When we're in the epidural space, then we slide a little thin catheter through the epidural needle, and then the epidural needle goes away. So all that's left inside is this thin little catheter. It's very small, and it's made out of silicone, so it's non-irritating, and that allows medicine to continuously be given to you until the baby's born. Now, the great big bones, when people fall down and break their back or they have a ruptured disc, those bones are deep inside. And we're not going to bother those bones, so we can't give you a ruptured disc and we can't give you a back fracture. Now, some women will have pain in their back after their baby's born, and that has to do with the fact that the baby is pushing on this area, and also the belly is falling forward during pregnancy, and that literally pulls the lumbar spine forward from the sacral spine, and it's called a spondylolisthesis. And that spondylolisthesis doesn't go away until you get your belly back in shape. So even if you don't get a labor epidural, you can still have this back pain. Likewise, can you get a spinal headache? Of course you can, and that's because of this fluid-filled sac. If the epidural needle punctures that fluid-filled sac, a person can get a spinal headache. Now, sometimes we can go ahead and slide that catheter in and put it in that fluid-filled sac, and now we have a spinal catheter. Not everybody who gets a wet tap or a hole in that fluid-filled sac gets a spinal headache, but some people will, and we'll talk to you about that and follow you over time. Sometimes we can thread the catheter into that fluid-filled sac, and now what we have is called a spinal catheter, and we can still use that. After the epidural catheter is in place, we're going to do a test dose. The test dose isn't designed to make you comfortable. It's designed to make sure that we know that the catheter hasn't gone someplace where we don't want it to be, like an epidural blood vessel. There are veins there in the epidural space. So they will ask you when they place the epidural, do you feel certain sensations or do you notice certain things? We don't expect those things to happen, but if they do, we need you to tell us. Now, anytime you make a hole in somebody's skin, there is a possibility of infection. Fortunately, epidural infections are quite rare, and we clean your skin with a special cleaning solution before we put the epidural catheter in, and that reduces the odds that there's going to be any germs involved. We also use sterile gloves on our hands, we wear a mask, and we keep our field very sterile so that nothing is allowed to touch it that shouldn't be touching it. And that decreases the odds that anybody's going to develop any kind of an infection. When infections do occur, if they occur in that epidural space, then that does require an emergency surgery. I've never personally seen one of these, and I did work at a place where we did 10,000 to 12,000 deliveries a year, and I worked there for almost 10 years, and I've never seen one of these infections. Sometimes epidurals don't work, and that's a little more common than anything else. They might work with patchy, in other words, you get some areas that are numb and some areas that aren't, or it just simply doesn't work at all. And if that's the case, what we try to do is replace the epidural so that it does work for you. It's very rare for people to have any kind of septations or scar tissue in their epidural space that totally prevents them from getting medicine. But those people are usually people who have had spine surgery. And if you've had spine surgery and you have rods in your back, then you may not be eligible to get an epidural, or even if you get an epidural, it may not work perfectly for you. I hope this answers a lot of your questions about epidurals. Now, some things that you do have to know is that we're going to be measuring your blood pressure a lot, and that's because labor epidurals take your pain away, and the medicines cause what's called vasodilation, that is, the blood vessels relax a little bit, and sometimes the blood pressure goes down. And when that happens, we need to give you medicine to get your blood pressure back up where you're comfortable and where the baby's comfortable. Sometimes, too, after a labor epidural is started, the combination of taking the pain away and Pitocin, whether it's the Pitocin that comes from the baby and the mom or Pitocin that's given to you by an obstetrician, those two things combine and can make the baby's heart rate go down. It happens in about 2% of epidurals. It doesn't usually cause a C-section, but it will cause us to do a few things like turn mom to her left side, put some oxygen on, stimulate the baby, give some medicine to get the blood pressure and the heart rate back up. It's pretty uncommon, but we do that on occasion. So if you have people telling you we need to turn you on your side and put oxygen on your face, that's probably what's happening. I hope this answers most of your questions. I'm sure when you get your labor epidural, you're still going to have some more questions, and we're happy to answer them. Thanks.